Heat and DSM-5, episode 4. We'll take a quick look on how to apply heat system on remaining chapters of DSM-5, which covers disruptive and impulse control disorders, conduct disorders, feeding, eating, elimination, sleep, wake, gender dysphoria, sexual dysfunctions, paraphilic disorders, personality disorders, substance-related addictive disorders. We'll do it as quickly as possible and then go to the real life cases where at ease, at liberty, and in great details, we can take up one case, one disorder, and apply the heat system. And that itself will take almost 3 hours. So we will do a concise outline overview in this session. And then with this, we'll complete this outline series and move on to real life cases, which unfortunately I can't record and put it on YouTube. But those who are interested can attend those seminars or supervision sessions. So based upon the complaint, certain part of every case history does take a change. The emphasis shifts, especially when you are looking at it from a psychoanalytic point of view or a holistic point of view involving psychoanalysis. So when we are looking at disruptive impulse control conduct issues, it's very necessary to look into superego development, ego development, and from a quotient standpoint, the healthy self and the cohesiveness of the self. And naturally, if you have to look at this, we need data from real life, and that will come if we ask the right questions. So that way, the case history will slightly take a turn in this disorder. When we look at feeding and eating, we will be taking additional data on greed, on internalization. And of course, questions have to be framed in ordinary language, looking for ordinary events, but giving us information on this psychoanalytic aspect of swallowing, internalization, taking in the problem of invasion, the problem of torturous invasion, killing invasion, not just a pain-giving invasion, but even a murderous or a torturous invasion. Elimination to do with letting go, with anal fixation. So something of the anal stage, or something where some part of the life where the anal part manifests itself. Sleep wake, very important in terms of to take data in terms of repressed anger, repressed sadness, difficult to accept thoughts you can get in touch with in sleep. And therefore you keep avoiding it, or waking up where the difficulty is with encounter with them, or the ending of forgetting, because waking means the ending of forgetting of certain things. So here in sleep wake, we'll be looking at very subtle repressed affect, difficult to accept things. Gender dysphoria, it's very clear what we are looking at. The two words are very clear. Sexual dysfunctions, we need a lot of data from Freudian, Clydian standpoint related to Oedipus, relation with authority figures, the resolution of the Oedipus, the entanglement with the maternal, the fear of fusing back into the body of the mother, the nature of sexual dysfunction. Is it a universal sexual dysfunction, or do we see different behavior when it comes to masturbation, oral sex, vaginal sex, and anal sex? Is the dysfunction specific to certain groups of women, or is it common to all women? Or if we are looking at a homosexual case, then correspondingly some men or all men, or some women or all women. Paraphilic, we would look at the repressed sexuality and the displacement, and why displacement on certain things only, the unconscious story related to that. So the case history will take a turn looking at that part, exploring that part. Personality disorders, very important, early life object loss, object attack, unpredictability of the object. Substance related addictive disorders, we would again look at from a psychological standpoint, what is the rationale of the addiction? Is it an escape from anxiety? Is it a self-destructive rage? Is it an answer to fragmentation anxiety? Is it a, did it start as a way to belong to a group and have social acceptance and social esteem, and then turned into a biological addiction? Is there a need for almost parapsychological type of experiences? Is there a constitutional need for an intensity of experience which is otherwise not possible? Is there a constitutional similar need for esoteric experiences? So this is the way, based upon our prior knowledge of these areas, once we get the complaint, the rest of the case history taking slightly takes a turn. When it comes to testing, each of these will need special tests. Fortunately, we already have it. So inventories are available. So this second will not be applicable. Rather, we'll add certain things to this. And this, of course, will be. But in this, we don't have to do a ROSHA compulsorily. We don't have to do all of this. We can have a disorder specific test, and then to complement it, we might do a TAT-CAT. That should suffice. This is as usual. For each symptom, we go through the process. Each disorder, we go through the process. Applying the generic causation model, 3.2.1, 0.2.3. As usual, they will be the primary drivers of causation. Three point 2.7 in certain cases of gender dysphoria or paraphilic conduct disorder. From a holistic standpoint, this also can be considered. Here, the best school or the best causality explanation will differ from disorder to disorder. In disruptive and impulse control conduct disorder, ego development, superego pathology, and the behavioral aspect of learning control, those three approaches will be very useful. In feeding, eating, elimination, sleep wake, primarily Freudian and Kleinian approach will help. Gender dysphoria, a more holistic approach involving yin and yang and involving social values, elements of guilt and shame. Sexual dysfunctions, the Freudian approach, and in some cases, the Kleinian approach. Paraphilic, Freudian approach. Personality disorders, early life object loss. I have developed a valley junction model, which actually is in one way, it's an innovative development, but the closest to it from which I learned something was from Marvin Hurwitz, his work on annihilation enzyme. Substance-related addictive disorders, we use the generic principles of psychoanalysis rather than any particular school. Principles of escaping anxiety, self-destructive rage, displacement, search for an all good object, a good, reliable, stable object, which is found in the substance to which you are addicted. At times, using the substance to bring about uh, a solidity, a coherence, a sort of contraction in the middle of expanding, out of control, disintegrating, fragmenting anxiety. Or it may be just too much of the death instinct in the pleasure of the self-destructive death instinct. From the East, Tantra psychology can be most profitably and practically used. Sri Aurobindo's psychophilosophy is very comprehensive, more comprehensive, but difficult to learn, difficult to customize and apply to this area. If you can, the best, but practically speaking, the Tantra psychology from the East should be fine. Heat, yes, if you want to go into the elemental levels of the phenomenon. Ironically, accumulating elementals will be very useful in conduct and disruptive impulse control disorders, where this on the positive side does not happen. When we look at paraphilic, gender dysphoria, yin and yang is very important. When we look at personality disorders, the karmic component becomes very important. Five bodies, they are important in all the disorders. when we look at the superego pathology, it is spread across in conduct, in gender, partly into sexual dysfunctions. In some measure here, it's not completely a superego pathology, but in some measure it is there. And here, weakening of it. So we look at too strong a superego and too weak a superego. In the disorders that we are looking at, we will see these motivational elementals at play. 4.1, 4.2, 4.3, 4.4, 4.5. They will be the major players, 4.1 to 4.5. We go to the each of them. Disruptive impulse control and conduct. It will have rage and anxiety as the important effects. If you look at feeding, eating, and elimination, it will have greed, aggression, holding on to objects, difficulty of object separation, unresolved object loss as the core issues. Sleep wake will be looking at sadness, anxiety, and aggression. Gender dysphoria will be looking at yin and yang issues as well as sadness and shame. Sexual dysfunctions will be looking largely at guilt, fear of castration, and the fear of uh, fusion back into the mother's body and the fear of being swallowed. Also, the fear of uh, intense pain because the torturous and murderous bad objects are put into that erotogenic zone. Paraphilic will be looking at pleasure, fear. In fact, pleasure, fear, anger, sadness, guilt will be common to most of the difficulties. Same with personality. In substance related and addictive, apart from it, the anxiety will take a peculiar form many times of coming up in the form of a fragmentation anxiety or a search for intensity. Expression will be very important in personality disorders, where largely speaking, adequate expression has not happened. This will also be very important in somatic disorders because the repression of expression is one of the highest in somatic disorders. Because the repression goes so high that it is pushed down into the body. Process elementals, of course, will be, all of them will be active. One important element here, when we look at this model of excessive pathological effect turning into symptoms, essentially we are using the hydraulic model. Now, the hydraulic model is common to Freud and ISTDP and partly true for Klein. Because in Klein, the moment we go into internalization of a good, reliable, stable object, and in Kohut, as we go into holding and empathy, allowing creation of a healthy self, the route to healing becomes very different. So, two core questions: how does pathology arise? and how is it healed. That on that there are differences between the Freudian school and ISTDP on one hand, which are essentially based upon the hydraulic model, and you have other schools which are non-hydraulic in their nature. Like for example, if you look at cognitive schools, they are not into affect per se, they are into cognition. That once the cognition is set right, the pent up affect, even if it is there, will not cause pathology, or it will get reversed in some way. Just as it got built up, it will be unbuilt. There is a kind of accumulation of affect and there is an erasure of affect. It's reversed. The build up of affect is reversed. And in case of Kohut, the ego becomes, the self becomes successful enough to repress or use defenses productively, and much of the bottled affect which was created because of those factors which did not allow the creation of the self, that accumulated affect also in some way disintegrates or reverses and in a way erodes away. So when we look at this process elementals, these are essentially hydraulic model based process elementals. I'll add to it in terms of the non-hydraulic elementals. Both of them will be activated. If these three are in place and strong enough, pathology won't happen. Inevitably, they have been overrun by their negative counterparts. In the list that we are seeing, we'll also see in paraphilic, sadistic sexual disorder, masochistic sexual disorder, and of course, anger, satisfaction, frustration will always play a role. Rejection also will play a role. Pain, of course, plays a role. Envy in certain cognitive thought disorders and in certain forms of attacks on linking plays a very important role. From a non-hydraulic perspective, the one of the centrality of envy is it stands in the way of internalization of a good, reliable, stable object. So that process significance of envy is very high. Guilt and shame, of course, play a very important role in gender dysphoria, in post impulse. After you do something out of impulse, it comes about guilt and shame. And in personality disorders, it's very important. Envy also plays a very strong role in personality disorders, especially in narcissistic and dependent. Both you see very strong envy. In some schizoid personalities also. 7.4, 1, 2, 3 are usually important in most of the disorders, but exceptionally, 7.4 is very important here for eruptive impulsive conduct disorders. Habit is very important. Reflex training is very important. So 7.456 are very important in conduct behavior eruptive disorders. And this is rare because 0.4, 0.5, 0.6, they are usually not in the center except in this category of disorders. Tragic holding states, this element is very important in personality disorders. Most personality disorders, people pass through this tragic holding state, where they have accepted and normalized the everyday suffering. 8.1, 8.2, we try to enhance. 8.5, we try to cultivate to the best we can. How we draw the holistic elemental causation. When it comes to holistic healing, for disruptive impulse control conduct, behavioral component is very important. Of course, the psychoanalytic roots are important, but the behavioral part is also very important. Feeding, eating, eliminating, again, psychotherapy is very important. In impulse control, also psychotherapy is very important. Sleep, pain, even more important. In except for, yeah, not even except for, in all these disorders, psychotherapy is extremely important. There is little that non-psychotherapeutic tools can do in paraphilic or personality disorders. Substance, of course, we need help of medication. Impulse control, we may need help of medication. Sleep wake, also the help of medication. To manage the dysphoria, if it goes too difficult, then of course medication. Elimination, help of medication. But these are areas where, proportionately speaking, psychotherapy is centrally located. Four point one and 4.2 is important for all the disorders. 4.3 is very important for the conduct impulse eruptive disorder. And 4.6 is very important for the paraphilic as a part of their self-worth. Safety and self-expression, very critical for gender dysphoria, sexual dysfunctions, paraphilia. All these involve extremely stigmatized and shame-provoking sexuality. And substance-related, one of the key elements of therapy is acceptance. In feeding, eating, elimination, again, there is an element of embarrassment and shame. High body work, classical work, all of that is as we do always. In this category, EDT psychodrama is very profitable. Psychodrama, not many would be agreeable to, but EDT can be very effectual in these disorders. And Emotion-centered therapies also are very important for large-scale affect release. Consolidation is very important in all of this because the chances of relapse and unwinding of the gains of therapy is very high in the list that we are looking at. So consolidation takes a special central role, proportionately more significant than it is in other disorders. References, as usual, we take the reference of the generic epistemological process, generic epistemological elementals, and the heat essential effect system. And of course, this is important for the hydraulic model. For the non-hydraulic part of causality, other factors like internalization of a good, reliable, stable object, creation of a healthy self, experience of a good enough parent, feeling of safety, mirroring success from a quotient standpoint, self-acceptance and individuation from an Indian standpoint, they become the non-hydraulic components of healing. But for the hydraulic approach, this is a very good elemental generic system of looking at generation of the and once the generation of effect into the regulation and to symptom formation. Reference for a comprehensive sheet on the holistic tools that we have from which we can create a customized holistic healing solution for an individual.